歡迎大家出。
Welcome to the press briefing. We have today Dr. Chong Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Larry Lee, Hospital Authorities Chief Manager. The two doctors will give you some update on the confirmed cases and also on the hospital authority. First, Dr. Chong. Good afternoon. Yesterday, the total number of positive cases, 4,064, including 1,564 PCR positive cases and verified RAT positive cases 2,500. We also have 156 imported cases, 168 PCR positive, 18 RAT positive. And then today we have 8 death cases. For the fifth wave, the total is 9,256 death cases. Perhaps I will ask the hospital authority colleague to tell you something about hospital admission. Thank you. So far, we have 1,347 confirmed patients in the hospital. 172 are newly admitted patients, and then there are 419 patients in isolation ward and 38 in second-tier isolation ward. 434 patients are in the North Lantau Hospital, Hong Kong Infection Control Center. 141 are newly confirmed patients. 4 patients are in critical condition. 1 has had 4 jabs, 2 jabs, and 9 patients are in serious condition. Among the patients now in hospital, 26 are in critical condition and 26 are in serious condition. For 3 critical patients, they are now in the ICU. There is also newly reported 8 death cases, 4 male and 4 female, aged between 75 and 103. 2 99 years of age, and for 1 patient 103 years of age, and female patient, and another 91-year-old male. They passed away the night before yesterday. And then 3 patients passed away, 3 male and 2 female patients passed away yesterday, aged between 75 and 100. All these 8 patients did not come from homes. 2 had 1 jab, 1 had 2 jabs, 1 had 3 jabs, and 4 had no vaccination record. First, the 91-year-old male, he had 3 doses of vaccine. He had hypertension, and then he was admitted to the Tumen Hospital through the A&E ward on the 27th of June. He had a fever when he was admitted, and then the RAT test was positive at the A&E ward, and then also the PCR test was positive, a CT value 28. He had some pulmonary problems, and then he had 2 tests later with a CT value of more than 30, and then he was transferred to a general ward, but then his condition deteriorated and he passed away on the 22nd of July. And then 103-year-old female, she had hypertension and arthritis. She also had vaccine. She was admitted through the A&E ward at the Queen's Elizabeth Hospital on the 23rd of June. She had a stomach ache, and then some tests showed that there was abscess near her back, and then there was no sign of pneumonia from the X-ray check. And then on the 10th of July, she tested positive PCR, and then her condition was fluctuating. On the 22nd. Her blood oxygen level dropped, and she passed away. And then a 99-year-old female, no vaccination record. She had a stroke and heart disease and other problems. She was admitted through the Tumen Hospital A&E ward on the 18th of July. She had cough and she had a loss of appetite, and then the RAT test was positive, and then X-ray showed pneumonia. And then when she was admitted, there was signs of possible cardio problems, and then we gave her medication, but then her condition continued to deteriorate. On the 22nd of July, she passed away. fourth patient, a 100-year-old female with no vaccination record. She had inflamed pancreas before, and she became unconscious at home, and then she was admitted to hospital. And then from her medical history, 10 years ago, or rather 10 days ago, she was tested. She tested positive for COVID, and then she came to the hospital for emergency treatment, but the condition deteriorated, and then on that morning she passed away. The fifth, 87-year-old male who had one dose. He had hypertension, and cardio disease, heart disease, and also stomach cancer. And he was admitted. He went to the Ratanji Hospital in Ewart on the 3rd of July because he had a sore throat. And then on the 1st of July, he did an RT at home and it tested positive. And then when he came to the hospital on the 3rd of July, the RT test was still positive. And then X-ray showed pneumonia. He was admitted to hospital. We gave him remdesivir and also antibiotics. And then he had bleeding in his stomach. He had shortness of breath and heart palpitation. And then his condition deteriorated on the 23rd of July. He passed away. Sixth patient, 88-year-old female, no vaccination record. She had hypertension. She was admitted to hospital through the Tianmin Hospital in Ewart on the 26th of July. She had cough and her overall condition was poor. And then X-ray showed pneumonia. And then CD value is 19.4. She was admitted to the medicine ward in the Tianmin Hospital. We administered remdesivir and steroid and so on. And then on the 30th of June, her condition stabilized, and then she was transferred to the North Lantau Hospital, Hong Kong Infection Control Center for continuous treatment. On the 12th of July, her condition worsened, and she had shortness of breath and heart palpitations, and then she was transferred to the North Lantau Hospital, and then her condition continued to deteriorate. On the 18th of July, we started to administer morphine to her, and then she passed away on the 23rd of July. Eighth patient, 86-year-old female. She had 2 doses of vaccine. She had hypertension, dementia, and so on. She was admitted on the 20th of July. She had shortness of breath and a low blood oxygen level, and then she did RAT on the 17th of July. It tested positive, and then when she upon admission screening, it also tested positive. CT value below 20. She was administered with remdesivir and steroid, but her condition continued to deteriorate, and then on the 23rd of July she passed away. 75-year-old male, no vaccination record. This is last patient. And he had hypertension and also stroke. And then she was admitted to hospital on the 4th of July. He had a fever and vomiting. And then on the 3rd of July, the day before he was admitted, he did an RAT and it tested positive. The CT value was below 20. X-ray showed pneumonia. And then when he was admitted to North Hospital, he was given different medicine. On the 6th of July, he was transferred to the North Lantau Hospital, Hong Kong Infection Control Center for continuous treatment. On the 11th of July, we found that he had more frequent shortness of breath and his heart enzyme level rose. And then he was admitted to the North Lantau Hospital. He was sent to the North Lantau Hospital Accident Emergency Ward, and later he was transferred to the ICU of Princess Margaret Hospital. His condition remained, unstable, and on the 23rd of July, he passed away at 4:11 a.m. Now I'll hand over to Dr. Chuang.
For imported cases, there are 186 cases. 76 such cases were picked up at the airport. The specimens tested positive. 75 cases were picked up at quarantine hotels. 35 cases were found after the people left the quarantine hotels. Among the 186 cases, they come from 51 places. 4 places contributed more than 10 cases. From the UK, 31 cases, US, 25 cases, Philippines, 17 cases, India, 15 cases. For the rest, 47 cases. These countries contribute to a lot fewer than 10 cases each. 1 care home, elderly care home, and 4 care home for persons with disabilities where quarantine is needed. 1 care facility in Kowloon, 黃章健紀念老人之家, a care home for the aged. 1 resident and 1 worker got infected. 4 residents need to be quarantined. 4 care homes for the disabled, 1 in Kowloon called 婦女福利會黃章健紀念老人之家宿舍, where 2 residents got infected. 15 residents need to be quarantined. At another care facility, Poland Kok Deng Yik Ji Zhong Sim, 1 resident and 1 worker got infected. 4 residents need to be quarantined. At another care facility called 香港善道會巡造中途宿舍, 2 residents got infected. 4 residents need to be quarantined. At another care facility, Tonghua Group of Hospitals, Jockey Club Care Facility and Hostel, 1 worker got infected. 1 resident needs to be quarantined. It's Sunday. There are no classes, but 1 school we recommended 1 week class suspension. For 1 class, it's Yanchai Hospital Choi Hin To Primary School, Class 6C. There are 25 students. 3 students caught the virus over the past few days. We recommended a 1 week class suspension for this class at this school. Now, the daily case number is at a high level. There are no signs of a drop in the daily number. We recommend that people follow the COVID control rules and follow the quarantine and isolation rules. They should wash their hands. As Dr. Larry Lee just said, some recent death cases involve people who haven't got jabbed, especially among the elderly. For those aged over 80, the death rate is over 16%. For those triple jabbed, the death rate drops to 1%, so that's a huge difference. If there are seniors living with you and they haven't got jabbed, or you have relatives who haven't got jabbed, bring them to a vaccination center. That's all from me. For the hospital authority, yesterday, 92 patients recovered, 82 have been discharged. 5 patients were found COVID positive through admission screening. 6 patients or workers in the same ward were classified as close contacts. Among HA workers, 35 workers caught the virus. 25,578 workers got infected. 12 workers have returned to work in total. 24,981 HA workers have returned to work. That's all from me from today. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The lady at the back. I'm from RTHK. First question for Dr. Trung. The dean of the CUHK Medical School said that the daily COVID case count may reach 5-digit territory. When can we see a 5-digit daily case count at the soonest? The CUHK Medical Center said they set aside beds for highly infectious patients. Apart from the CUHK Medical Center, are there other private hospitals that have indicated their willingness to help the HA by taking in COVID patients? Now, a question about monkeypox. The WHO now has listed the monkeypox as an international emergency. Is there a huge risk for monkeypox to find its way into Hong Kong? Should we look out for monkeypox? Do we have any vaccine for monkeypox? Are you still making the inquiries for such vaccines? When can we expect monkeypox-specific vaccines in Hong Kong? Now, based on the numbers from the past 2 weeks, the daily case count doubles every 2 or 3 weeks. We hope the number won't rise to a very high level, and we hope that it won't rise very quickly. We hope people can follow the COVID restrictions so that the number won't reach a very high level. For monkeypox, the World Health Organization has classified monkeypox, which has seen outbreaks in many countries, as a public health emergency of international concern. The government will closely watch the situation and take the necessary preventive measures. We will also take reference from the WHO's advice by stepping up monitoring and stepping up the relevant education initiatives. Relevant colleagues of finding out about the vaccines and how to get the vaccines to Hong Kong. We will notify physicians of the WHO's advice and recommendations so that they can keep an eye on the situation. For monkeypox, it has to do with contact with infected animals, people, or objects. It usually involves direct contact with bodily fluids or people getting bitten by infected animals. But prolonged face-to-face contact, say for people living in the same household, where droplets may be involved, in such cases, infection may also happen. Infected people develop a fever, serious headache, or muscular pain, or a swelling of the lymph nodes. And then after 2 or 3 days after the fever, there may be ulcer in the mouth. And in other parts of the body, there may be rashes. The incubation period is usually 5 to 21 days. Some countries have conducted studies within 7 to 9 days. That's the incubation period. If people go to affected places, they should avoid contact with the infected people or infected animals. And when they have come into contact with such people, they should look out for their bodily conditions. If they feel unwell, they should seek medical attention. We have laboratories in Hong Kong that can provide services that can help pick up the disease. As for private hospitals, over the previous outbreak, the hospital authority has a collaboration or coordination mechanism with private hospitals. For patients, including both COVID and non-COVID patients, where necessary, they can be transferred to private hospitals to continue their treatment. Apart from the TMHK Medical Center, there are other private hospitals that have helped out in taking in non-COVID patients. So these are hospital beds offered at concessionary rates. We will keep an eye on the COVID situation. Through this mechanism, we will transfer suitable patients to private hospitals for treatment. Now, the private market can help in many ways. When the outbreak was very bad, or at this time, at the North Lantau Hospital Hong Kong Infection Control Center, the Asia World Expo, or at Penny's Bay, there are doctors taking part, helping out on a part-time basis. The lady over there. I'm from cable TV. A question for about monkeypox. How big is the risk of a transmission of monkeypox in Hong Kong? What's the CHP's assessment of the risk of the monkeypox finding its way into Hong Kong? The monkeypox has a longer incubation period. Some countries in Europe or in North America, in 6 regions, 72 countries, they have reported more than 14,000 suspected or confirmed monkeypox cases. Most cases involve contact between males. This disease comes with a longer incubation period. In some parts of Asia, they have seen imported cases of monkeypox. There is risk that we may see imported monkeypox cases. But the transmission happens when close contact happens. If we can monitor the cases, then we may be able to prevent the large-scale transmission in the community. In early June, the government announced a contingency and preparedness plan for monkeypox. I hope that people can look out for the condition. If they feel unwell, they should seek medical attention. Next question, the lady over there. I'm from Now TV. Recently, there has been a rise in the hospitalized children. What's the occupancy rate for pediatric wards at public hospitals? Do you have enough healthcare manpowers? A couple of days ago, at the Kwun Tong Sao Mau Ping Discipline Services quarters and the police quarters in Taiwan, they are subject to compulsory testing. Do we have the results of the compulsory testing? I want to follow up on the private dinner involving Cathay Pacific staff. Are there additional patients that identified at the cluster? Now, for pediatric wards, Overall, the pediatric ward occupancy rate, I don't have the number at hand, but for pediatric isolation ward where we care for COVID patients, the occupancy rate is at 48%. As for intensive care units, the usage rate is 50%. Sorry, I don't have the figures related to the results of the compulsory testing notices. As for smaller scale clusters, I don't have the figures at hand. Next question, the gentleman over there.
I'm from AM730. Now, there's mention of the CU Hong Kong Medical Center. Apart from receiving non-COVID patients, what about your discussion with CU on receiving COVID patients? When would it start the earliest? And then private hospitals are also preparing to admit COVID hospitals. So what's the situation? And then for the 103-year-old female patient, was she infected at the Queen Elizabeth Hospital, and was her cause of death related to COVID? Now, final question on monkeypox. Has HA formulated a policy on isolating monkeypox patients? Would the arrangement be in conflict with the use of the isolation ward for COVID patients? Thank you. For private hospitals, the CU Hong Kong Medical Center, we have started a mechanism. There is this collaboration platform. If necessary, we could have a discussion on that. For other private hospitals, we are still in discussion with them. Of course, I do not have a firm timetable yet. For the 103-year-old patient, the patient was admitted on the 23rd of July for other problems, and then on the 10th of July, the patient tested positive PCR-wise, and we believe there's a good chance that the patient was infected in the hospital. As for monkeypox, we do have a contingency plan to remind healthcare workers what to do. And then Dr. Chuang just mentioned the symptoms, and we have passed the information on to our frontline staff. So we'll take the appropriate infection control measures, and if there is a need to hospitalize patients, they will send to the Princess Margaret Hospital. And then also we are in constant discussion with the Center for Health Protection so that we could keep updated on the development. I'm from Ming Pao. Dr. Chuang, now there's an announcement that you'll be increasing the number of compulsory testing locations, but then it remains at 60 or so. There's been no increase. So have you started working on providing more such testing centers? And what is the percentage of CTN cases? And then in fifth wave, some private hospitals took in COVID patients. How many patients did they take in, and how did the scheme work? And then finally, if there have been many elderly who passed away recently, and they only did RAT at home, and only when there was a problem they were sent to hospital. So what's the criterion for sending them to hospital? Would you need to revise that admission criteria? I think our Bureau will continue to step up CTNs. I don't have the figures involving CTNs recently, but there's been an increase compared to the earlier period. For private hospitals, you mentioned the CU Hong Kong Medical Center. Yes, during the epidemic, they did take in patients, but I don't have the exact figures at hand. And we welcome this arrangement because that would really help the public hospital sector. You asked about patients, testing RAT positive on their own, and then some patients did the RAT at home, and then they started to feel unwell. Then they went to the accident emergency ward. So I would suggest to patients that if they feel unwell, they could see a doctor. There are several ways to do that. Say if the condition is poor, they could go to the accident emergency ward. There are also designated clinics, and they could also go through our hotline or actually go to arrange for a teleconsultation. Next, please. No, that's the end of the press briefing. Thank you.